No one is thrilled to have surgery, no question about that. However, probably the most important part is that, number one, they understand that they have options. So one of the newer techniques that we've been adopting is a technique called the superior capsular reconstruction. It solves a problem that we had that currently we no longer have. In that, if somebody has a rotator cuff tear that you cannot fix, the treatment options for that patient were either live with it, or you can go in there arthroscopically and do a debridement, so you just clean things up, but you cannot fix the rotator cuff. Typically that patient, there was a significant amount of dysfunction, pain. Not everybody did great from that operation. What the end game would be a reverse replacement. So you're going from an irreparable rotator cuff tear to a reverse replacement. There was no in-between other than living with it. So what we're doing is we're using a cadaver patch to take the place of the rotator cuff.
I had requested for him to replace my shoulder joint because it was so bad. About 2 weeks before the procedure was going to take place, I came in to see him to set everything up, and he mentioned this different procedure, which sold me on the whole idea. Rather than putting a new joint in, this is what I could do before. Within 2 months after the surgery, I had no pain. I could move my arm twice as much as I used to move it.
We're taking a piece of cadaver skin, and what we're doing is we're attaching it to the socket, and then we're attaching it over to the humeral head. And really what you're doing is you're allowing the glenoid, which is the socket, and the humeral head, which is the ball, to maintain a relationship. Because when you're cuff deficient, what happens is the humeral head will tend to rise up. So you'll see people and they'll try to raise their arm and they cannot do it. So what this does, you have the patch of tissue and it keeps these two structures aligned and then allows your deltoid to help you raise your arm. We've seen excellent incorporation of the cadaveric tissue to the existing structures. So in short, we're very excited about the procedure because it's giving patients an opportunity to raise their arm without having to put in a reverse replacement.
There's nothing like a doctor that knows what he's talking about, goes in, does the job, and you eventually come out with what he said you were going to come out with.